us toll-free or visit kidneycar.ca.
You're watching Rogers TV, Barrie.
So as of today, we've got a total of 15,210 cases, up over the past week by 447 cases. The case count increased by 25% compared with the previous week. So over the week of the 14th to the 20th of November, we had 415 cases compared with 332 cases the week before. And in fact, we have had a total of 6 weeks now. 1, 2, 3, 4, 5 weeks. 5 weeks in which we've had week-on-week increases in our case count. Our active cases have increased to 522 from 428. And we've had a total of 278 deaths. So this is an additional 3 deaths over the past week. I would like to express my condolences to the family members for your loss. So they consist as following: a woman between the ages of 45 and 64, from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, and a man between the ages of 65 and 79 from Simcoe County. Currently, we have 25 people from Simcoe Muskoka in hospital with COVID-19, up from 19 a week ago. So this is an increase. And this includes 6 people in the intensive care unit, up from 5 a week ago. Their ages range from in their 20s to their 90s. 24 from Simcoe County and 1 is from Muskoka. 8 of them were acquired in the community, 10 close contacts of the case, 4 as part of institutional outbreaks, 2 are under investigation, 1 part of a congregate setting outbreak. 68% of them, or 17 of them, have no record of vaccination. 6 were fully vaccinated and 2 were partially vaccinated, meaning a single dose out of a 2-dose series. Today, in the last 24 hours, we've had 60 cases. 56 of them are sporadic, 4 part of school outbreak, were school outbreak related. 37 were male, 23 female. Their ages range from under 10 to in their 60s. 28% of them were under the age of 12, and the majority of these were school-aged. 51 were from Simcoe County and 9 from Muskoka. With regards to their acquisition, 40 are under investigation, 10 are close contacts of the case, 5 are community acquired, 4 are part of educational facility outbreaks, and 1 is travel related. 59 are self-isolating at home, and 1 has resolved. 21 have no record of vaccination, 2 are partially vaccinated, 20 fully vaccinated, and 17 not eligible to be vaccinated because of their age. Or actually, now that we're in transition, commencing vaccination of those between the ages of 5 and 11, I think we'll probably have to be clearer about that last point. But still, at this point, they wouldn't have been able to get, the 17 able to get vaccinated because of their age. Most of our active cases are in Barrie and in South Simcoe. But we do note that Muskoka is also experiencing a surge in cases with outbreaks, primarily in schools. or other settings involving children. So for the week of November the 14th, Bracebridge actually had the highest incidence at 172 cases per 100,000 population per week. Barrie, second highest at 125 cases per 100,000 population per week, up from 106 the previous week. Agila, Tozoratio, 93 cases per 100,000 population per week. Penetanguishene, 93 cases per 100,000 population per week. Huntsville, 92 cases per 100,000 population per week. And Severn at 87 cases per 100,000 population per week. Barrie's incidence has been increasing over the last 5 weeks. So 5 weeks ago, during the week of October the 10th, they had an incidence of 25 cases per 100,000 population. So now up to 125 cases per 100,000 population. The weekly incidence for all of Simcoe Muskoka is 69 cases per 100,000 population per week. And we note that right now Muskoka's is just about 80 cases per 100,000 population per week. And that is the highest that Muskoka's ever had in terms of its incidence of cases. And the first time that it's higher than Simcoe County at 68 cases per 100,000 population per week. And the province's rate right now is 31 cases per 100,000 population per week. So we are more than double the provincial rate. And we went up from 55 cases per 100,000 population per week last week, whereas the province was at 27 cases per 100,000 population per week. So we're going up at a higher rate in the province. We're more than twice the incidence of the province at this time. And as I've said before, this is the first time in the pandemic during the month of November that we've been above the provincial rate. Throughout most of the pandemic, we've been riding at about half of the rate of the provincial average. So for 5 weeks in a row, we've had a rate that's been higher than the provincial rate. Actually, I'm going to be really specific now. Muskoka's incidence per 100,000 population is 81 cases per 100,000 population per week. And Muskoka, I have to self-correct, is 87 cases per 100,000 population per week. 24 of our cases over the past week were among children less than 12 years of age. And as I indicated, the majority of those are school age, between the age of 4 and 11. We presently have 26 outbreaks, up from 23 a week ago. The great majority of these are in primary schools. And also we've seen congregate settings that are affected as well with children. But we do have a church that continues to be an outbreak. And we do have some community shelters that are an outbreak as well. And later I will be speaking about other settings in which we have had cases occur, but have not been able to declare them as outbreaks. But it's important to note those other settings to give you a sense as to where the cases have been occurring and where possible transmission has been occurring. With regards to vaccination, the province's goal is more than 90% coverage for first and second doses for those 12 and above. I don't know actually if there'll be a formal change in the provincial goal now that children 5 to 11 can also become immunized. So we'll have to wait and see what they do with regards to that additional eligible population regarding their goal. But for now, we have the target of 90% for first and second doses for those that are 12 and above. So in Simcoe, Muskoka, we're now up to 88% of those 12 and above who've received a dose, and this is up by 1 percentage point from 87% a week ago. And 85% have received 2 doses, up from 84% when I reported a week ago. Our coverage remains lowest among young adults. Males more so than females, but progress is being made in that age group as well. And 21,192 residents of Simcoe Muskoka have received their third dose of vaccine. The rate of COVID infection among the unvaccinated eligible population, those 12, I'll just say it, those 12 and above, is 7 times higher than it is for those who are fully vaccinated in Simcoe Muskoka using our local data, and their hospitalization rate is 12 times higher. And during the week of November the 12th, 38% of our cases were among the fully vaccinated, up from 30% a week ago. And as I've stated on a number of occasions more recently, we will expect that percentage to go up over time as we move towards achieving an ever higher coverage in the eligible population. As you move towards 100% coverage, the only cases that can occur under that circumstance would be among breakthrough cases. When we look at our dashboard, we are in red status overall, red status for viral spread and containment due to our increasing incidence of cases, and our reproduction number of 1.2. So anything above 1 indicates that the pandemic is growing here. With regards to laboratory testing, we are in yellow status, and that is because we've had more recently a high percent positivity. We're now up to 3.9. So anything above 3 is of concern. This is basically the percent of our tests that come back as being positive, and it's an indicator both of the amount of transmission happening, but also the sufficiency of volume of testing that's taking place. Our turnaround time for laboratory testing is within target, 89% of tests coming back with results within 1 day. The health system is in yellow status with regards to its capacity here, and we do have a high acute bed occupancy overall, though unrelated to COVID-19. There would be other things that are driving that. And the public health capacity remains in red at 67% of our cases being reached within 24 hours. This is an indication of ourselves as an agency being stretched with a high case count and our ability to get to people within 1 day. Okay. So we are definitely experiencing a substantial rise in our cases, our incidence of cases. And this is of concern to me. And I do want people to be fully aware of the fact that we're among a number of health units in the province who have had a surge in cases. So the province as a whole has remained at a relatively low level of transmission. And this is certainly true in the Greater Toronto area. And we find that for the first time in the pandemic, we're well above the transmission rate for the health units in the Greater Toronto area and well above the provincial rate overall. Other health units that are affected like us are elsewhere and more in the periphery in the province. Kingston area in the east. There's a number of health units in southwestern Ontario that have a high transmission rate. Southwestern Health Unit in Elgin St. Thomas area would be one of those. And in the north, there are a number of health units that are so affected. Sudbury and Algoma both have very high transmission rates, well above 100 cases per 100,000 population per week. So it's important that people be aware of that and to be aware that immunization is the single most important thing you can do to protect yourself. And I would advise people who are eligible, who've yet to be immunized, to seek out immunization. And now that we are able to offer vaccinations to children turning 5 years of age in this calendar year, and above, so the 5 to 11 is now newly available, that people can book online, and we'd be very happy to provide vaccination in our clinics. So that's available for people to start booking now. So vaccination is the single most important thing you can do, but it is by itself not sufficient. You also need to keep in place the protective public health measures. And that would consist of, at this time, shrinking down your immediate social circle and sticking to the same group of people, and using masking and physical distancing in indoor public spaces. And for that matter, in your home, if you're unimmunized and you have other people from out of your home in your home, that people need to be self-monitoring for symptoms and isolating and seeking testing if they develop symptoms. Same with your children. You need to be screening your children for symptoms and keeping them from going to school. Given the very large number of outbreaks that we're having in schools, this is very important to help avoid more of that. There have been instances where people have not done that, that we're aware of, that's contributed to outbreaks in schools. So that's an important factor for people as well to abide by. Hand hygiene, always an important practice for respiratory infectious diseases in general. So all of those things are very important. Have always been through the pandemic important, but here in Simcoe, Muskoka, now more than ever, very important for people to abide by to reduce your risk and reduce transmission to others. So just a few things of note with regards to our experience at this point in time. One thing that I've noted already is now we're having just as much of an experience, or more so, of transmission in Muskoka than Simcoe. So this is something new and important for people in Muskoka to be aware of. Formerly, their transmission rate throughout most of the pandemic was much lower than Simcoe County. That is not the case right now. People need to be aware of that in Muskoka and take appropriate precautions. We've had nearly as many cases occur so far in November as occurred in total in September and October combined. We also note that our incidence is more than double the provincial rate. And if we want to look at the difference in the incidence of cases here among the vaccinated versus the unvaccinated on a per capita basis in those populations, as already indicated, the incidence is much higher among the unvaccinated than the vaccinated. But to have specific numbers, if we look at the last 8 weeks for those 12 and above, the incidence among the vaccinated was 188 cases per 100,000 population over that 8-week period. So for an 8-week period, versus among the unvaccinated, it was 855 cases per 100,000 population over that 8-week period. And in terms of hospitalization, among those 12 and above who are fully vaccinated, their admission rate to hospital was 5.1 per 100,000 population over that 8-week period, compared with 62 admissions per 100,000 population over that 8-week period for the unvaccinated population. So much higher risk, much higher incidence, much higher hospitalization rate among the unvaccinated population in Simcoe, Muskoka over the last 8 weeks compared with the vaccinated population. Really making clear how just very important it is for people to be vaccinated. We are experiencing a substantial growth rate right now in our cases. So from October the 1st onward, we've had an ongoing growth rate of 3.7%. And if this continues, we would surpass daily cases of 100, so 100 cases a day early in December. So by the beginning of December, we'd be surpassing that. We notice a few things about the characteristics of those who have been hospitalized versus those who are not. So over the last 8 weeks, we note that unvaccinated hospitalized cases were on average 13 years younger than the fully vaccinated hospitalized cases. So unvaccinated. So in other words, if you're younger and if you're unvaccinated, you're at a higher risk, even if you're younger, of being hospitalized compared with if you're vaccinated. 20% of the unvaccinated hospitalized cases in Simcoe Muskoka during that time were under 40 years of age, and there were no fully vaccinated individuals hospitalized in Simcoe Muskoka in the same under 40 age group. There is a likelihood, a significant likelihood of being admitted, even if you're under 40, if you're unimmunized and you become a case. Okay. So with regards to our outbreaks, as I'd indicated, many are children. Really, at this point in time, a great predominance of these outbreaks have been among children that have been under 12 years of age so far, haven't been able to be immunized. Also, just the large number of outbreaks that we have is of note, with 26 this week. The last time we had this many outbreaks was at the height of our third wave in the spring. 19 of the 26 outbreaks, or 70% of them, have involved populations that are up until now, too young to be immunized, so those below 12 years of age. So 17 are in elementary school settings. 4 of these have had more than 10 cases. And we also had a congregate setting for children. That's part of this group of population that had been too young to be immunized. We've also noted some of the outbreaks have involved individuals that have been more vulnerable based on age or medical condition or financial situation. 3 shelters that were part of outbreaks. And we've had 3 secondary school outbreaks and 1 place of worship as part of an outbreak. But when we look at the other locations in which we've had cases occur, or clusterings of cases that we haven't declared as outbreaks, they are as follows. A number of places of workplaces, multi-unit dwellings, recreational centers, places of worship, food premises, and other locations such as private vehicles or post-secondary institutions. As I've indicated, some of them have been food premises such as restaurants. We've also noted that there's a substantial increase in incidence among the age group 35 to 64, that's been steadily increasing since October the 17th, and is now 60 cases per 100,000 population per week during the week of November the 14th, as opposed to 16.4 during the week of October the 17th, so a month ago. And I think that this would be noteworthy because you're looking at a population that would have perhaps a lower vaccination coverage rate and also be a little older and more vulnerable to more severe outcomes of COVID-19. So, I would give attention to that group. That group as well needs to do what they can to reduce risk, which very much includes becoming fully vaccinated. The province has just received vaccine, and we locally have just received vaccine for children 5 to 11 years of age. We have approval from Health Canada and support from the National Advisory Committee for Immunization and support from the Ontario Ministry of Health to provide vaccination to this group. And we will be commencing in our community clinics on Friday. And vaccine is also being provided in participating pharmacies. The GoVax bus at times will be booked for this purpose here, and some primary care providers as well will be providing vaccine to that age group. But for us, we will be commencing on Friday with our clinics. We will, at that point, focus our clinics on the provision of vaccination for children 5 to 11 years of age. And also allow for walk-ins for those that are first and second doses as well. And would be able to provide vaccination for our entire local child population within a 3-week period to get their first dose. The interval for second doses for this population is 8 weeks or more. And we'd be fully prepared to be able to provide vaccination for the second dose as well. And they would meet that criterion. And at this point in time, we have a total of over 6,750 children who've booked in the provincial system to receive their vaccine in Simcoe Muskoka already, out of the 44,000 children of that age living in Simcoe Muskoka. So we look forward to continued bookings and the provision of vaccine to this population. This is something we strongly encourage parents and caregivers to encourage their children of this eligible age group to receive vaccine. And just to be clear, at the lower end of that age group, 5, it's those who are turning 5 in the present year who would be eligible to receive vaccine. Now, they don't have to actually wait until their birth date to receive vaccine. And if people want to get more information about this, please come to our website. We have information about vaccination in general, including for children of that age range, and encourage people to check that out and to book and receive vaccination. With regards to third dose boosters, as I've indicated, we're focusing our clinics for children starting on Friday. So others who wish to get and are eligible to get a third dose booster, they can book on the Provincial Vaccine Center portal and phone number, or through the Couchiching, Ontario Health Team Clinic and the Indigenous-led vaccination clinics. And if you wish to find more information on our website, please look there. And otherwise should be contacting participating pharmacies. And there's a list of that, a link about participating pharmacies as well on our website, and also the GoVax bus and some primary care providers as well participating. So we certainly encourage people to continue to get their booster doses. Noting that vaccination, first and second doses, provides powerful, persistent protection, but there is some waning of immunity, particularly in certain populations, such as those that are 70 years of age after you get out in the range of 6 months and beyond. So the interval for this would be 6 months after your second dose, except for those who are immunosuppressed to meet the definition of immunosuppression. And for them, it would be 2 months out from their second dose to get a third dose. And there's more information on our website as to the specific definition for those that would be considered immunosuppressed and eligible for that. As of yesterday, I have issued 2 letters of instruction requiring specific public health measures to address the rising case counts that we're having at this time, to help reduce the risk of transmission and try to address the pattern of transmission that we've seen. So we have seen very much transmission happening in schools, one of the letters of instruction will require proof of vaccination for children who are 12 and above to participate in organized sporting events in indoor settings that are not part of schools. Another letter of instruction, actually an order under the Health Protection and Promotion Act, will require quarantine for unvaccinated children 18 and under who have a household contact of a case who also is not vaccinated against COVID-19. So this is meant to get ahead of transmission and avoid transmission via that route from the household into the school setting. My letters of instruction also include additional content for businesses and certain service settings and workplaces, really an expansion of the content that had been in a previous letter, but now including places of worship because of the clusters that we've seen in some places of worship and an outbreak in one place of worship. And the requirements are in line with requirements that I had before in other settings, specifically that mask use be in place and enforced, physical distancing, maintenance of capacity limits to allow for physical distancing, and active screening for symptomatology, exclusion of people with symptoms, encouraging them to be tested, and the logging of contact information for those who are attending in these premises. So those measures are all meant to address transmission that we're seeing right now. And certainly I will continue to monitor what happens as we go forward in time. We're seeing a sharp rise in cases. It's very important that we take note of where that heads and keep track of what other health units have been doing in response to such a rise in cases, particularly those in the north that have had much higher transmission rates earlier than us, and be mindful of what they put in place, the potential for us to do so. I think we need to be aware of. With regards to upcoming holiday celebrations and gatherings, we do have some recommendations on our website about that. We do make a distinction for those who are immunized and those who are not, but overall I would say that it's safest to do so remotely. We're always advising that people be immunized. People always have to be checking for their symptoms and excluding themselves, isolating and seeking testing regardless. And I'm advising that people in general reduce the size of the gatherings that they have indoors in their personal lives and stick to the same group of people where you can. Those who are unimmunized need to be much more cautious when having people over. Physically distancing and wearing masks is my recommendation. And for those that are immunized, being aware of vaccination status as well. And it's always safer to be in close contact with people who are also immunized. So that information is on our website. And we also have advice with regards to participating in organized public events, outdoor events. And once again, it comes down to self-screening and vaccination, exclusion if you develop symptoms, and non-participation. And when participating, doing what you can to maintain distance 2 meters from others, and using a mask, particularly if you cannot physically distance, if that becomes challenged for you. And people be aware of the risks that can occur as you travel to attend the events. So when driving, if you're driving with others in your vehicle that aren't part of your household, wearing a mask, doing what you can to separate, having the window open for fresh air reduces the risk. At this time, since October, the province has had in place proof of vaccination for the attendance of people in a range of non-essential services. And this has been a very important public health measure that I fully support, that my colleagues across the province as medical officers of health fully support. And it's very important that businesses fully enforce the requirement for proof of vaccination. We have detailed information on our website as to what is required in keeping with what's within the Reopening Ontario Act on this front. So very, very important that they abide by this and enforce this. This is a system that only can work fully if there's full compliance with this. We've not had any instances that we've encountered in enforcement or had specific situations have been cited to us where we know a location where that's not been abided by, but just the same, it's important for businesses to be aware of this and also be aware of the potential for fines that would be incurred under the Provincial Offences Act related to noncompliance. So we have the following questions that we know from social media. In less than 6 weeks, children in their 12th year and eligible for a 30 microgram dose rather than 10 microgram dose. Why? How can one day switch whether you're eligible for a child or an adult dose? So just, I guess, to clarify this, up until the most recent communication that we received this week from the province about dosages for those children 5 to 11 years of age, we've had some children eligible to receive vaccination because they were turning 12 years of age this year, and they were receiving the adult dosage of 30 micrograms of Pfizer vaccine. But now with the new 5 to 11-year-old formulation for Pfizer vaccine, the dosage is 10 micrograms for those that are not yet 12 years of age. So we do have some children who fell in the category of being eligible earlier, who were turning 12, not yet 12, who received 30 micrograms for their first dose. And now when eligible for their second dose, would be going down to a 10 microgram dosage. And why is this? And what is this a problem or not? What I would say is, first off, we are going to abide by the province's requirements on this for children who are not yet 12 years of age, between 5 and 11, that they would receive the child dosage. This dosage has been set by Health Canada and in accordance with the National Advisory Committee on Immunizations recommendations, because by the data submitted by Pfizer under their clinical trials, that was the dosage used. It was found to be effective at over 90% protection level and avoiding transmission in cases. And from the data, essentially 100% protective of avoiding severe cases. So it's effective at that dose. And therefore, it's better to go with the lower dose because it's both effective and demonstrated in the clinical trials to be safe for that age group. So we are going to abide by that for the second doses for those children that fall in that category who are not yet 12 years of age. And if you have any children that are sort of the other category, they're beginning at 11 years of age to get their first dose. And then when they come back 8 weeks later, they've turned 12 years of age, they would be eligible for an adult dosage of 30 micrograms per 30 micrograms as a dose. Another question, when will Canada or Ontario decrease the age for getting boosters? The US is already doing so at 18 plus. So I understand that the United States is making available boosters 6 months after, actually I'm not sure of their interval, but they are making boosters available for those that are 18 plus. And we are following recommendations from the National Advisory Committee on Immunizations about which populations would be eligible at this time, priority to receive booster doses. And at the direction of the province as well, we are staying with those that are 70 plus, those that are adults in congregate settings for seniors, the adult Indigenous population, and those who had received AstraZeneca for first and second doses who are adults. So if and when the province changes on that, we'll be following that, but we are going to stay with the requirements in the province at this time. With the rise in cases, are you going to be putting more restrictions in place? So we just put in place the 2 letters of instruction and the order under the Health Protection and Promotion Act. As I've described, we are going to monitor the impact of those and also monitor what other health units are doing. We'll stay in close communication with the Office of the Chief Medical Officer of Health about all of this before determining if other public health measures are necessary. Okay, with cases increasing, why did we allow 3 consecutive weekends of hundreds of out-of-towners coming from all over Ontario for hockey? So tournaments such as hockey, if they follow the requirements for masking for the attendance, screening for immunization, they would be allowed to have events of that nature. And going forward, the attendants that are 12 years in age and above, the participants also, due to my letter of instruction, be required proof of vaccination as well. We became aware of those events. We made contact with the organizers. We had public health inspectors attend to ensure compliance with all of the public health measures for safety. And we indeed were going to be monitoring, along with many other things, situations such as this in the future with regards to case counts and the potential for other public health measures or restrictions if we deem them to be necessary. When are you going to acknowledge that COVID is airborne? So we follow the science as assessed primarily by Public Health Ontario, who puts out reports on a frequent basis, including on the topic of how is COVID transmitted. And so far, the consensus, the bulk of evidence, the interpretation of the evidence is that COVID-19 is transmitted primarily through droplets in the air at a distance of 2 meters away from an individual with COVID-19 greatly reduces the risk. But that being in an indoor environment is of greater risk. There's a potential for those droplets to persist and to therefore be infectious at a greater distance in an indoor environment, and very much more so than an outdoor environment. That aeration, ventilation is important to reduce that risk. Wearing a mask is very important to reduce that risk. Preferably being outdoors is a great way to reduce the risk. And there are certain situations where COVID-19 behaves much more like an airborne communicable disease with certain medical procedures that generate aerosols that can carry greater distances. So any kind of medical procedures involving the airway can create aerosols. And under those conditions, greater precautions are needed in the way of personal protective equipment for healthcare practitioners who are participating in those kinds of procedures. But like everything in healthcare in general, in medicine, and with COVID-19, the evidence evolves, and we have to continue to monitor the evidence about this and everything else related to COVID-19. So at this point, I'd be happy to take questions.
Thank you so much, Dr. Gardner, for your update this afternoon. As always, we take questions from the media, but we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start with Chris Simon from the Barrie Advance? Do you have a question today?
Of course. Hi, Dr. Gardner. Do you sense a reluctance among parents to have their children ages 5 to 11 vaccinated? I've talked to a number of parents in my school community who are vaccinated, didn't have a problem getting vaccinated for themselves, but they're still a little bit reluctant with their children. And if that is something that you sense, what do you do about it?
We know from some survey data that about half of the parent population wants to get their children vaccinated, are eager to get their children vaccinated. About a quarter of that population do not want to get their children vaccinated. And the remainder are hesitant, but would be willing to consider it a little later. So we're well aware of that. Certainly we need to make it available to all who would take it. And the greater the coverage, the better for the protection of children and the protection of the school environment, and to help avoid these outbreaks that are happening in schools and help maintain children safely in school. All of that's really important. We've got a robust response, over 5,000 parents already having booked their children to receive vaccination over the over 40,000 children between 5 and 11 years of age in Simcoe Muskoka. So that's a good immediate response. But I think we're going to have to wait and see exactly how it plays out.
Okay.
I would say that it's very much for us to be providing data and information, and to do so in an interactive way, town hall opportunities, that type of thing, as well as information on our website and via the media and via social media and via phone call to help parents. And it's also something that their own healthcare providers can be very assistive with, given that people have a much higher degree of trust, generally speaking, with their primary care provider.
Okay. And my follow-up question is, why haven't we seen information about an outbreak being declared at the town of Wasaga Beach?
We haven't actually declared an outbreak in that location. We've seen a number of places where there are clusters, and we place information about declared outbreaks on our website, but with clusters for which we've not declared, we don't place that on our website. So at this time, that would be the reason.
I'm sorry. Can you please explain what the difference is here? Because we have photographic evidence of town staff mingling without masks within close proximity. Please explain to me what the difference is between multiple clusters at a location and an outbreak being declared. And can you explain a little bit about the policies that should be in place for municipalities to prevent this type of thing?
So to start with your second question, I have communicated throughout the pandemic in writing to our municipalities, advising them about what's really needed to reduce risk of transmission in their work environment and in their council chambers, and have advised that reduce occupancy and remote work is safest. And also my letter of instruction to them, my letter of instruction to workplaces would apply to them. So we do advise that they have to keep down their capacity sufficiently to maintain a 2-meter distance as required under the Reopening Ontario Act. And within my letter of instruction, that they need to make available remote work where it's feasible. And to otherwise require mask use. The exception being if they are at their workstation and they're more than 2 meters away from other individuals. Under those circumstances, in keeping with the Reopening Ontario Act, they would be allowed to have their mask off. With regards to the declaration of an outbreak, that's really identifying evidence of transmission happening in the workplace or in a setting. not just that there were cases there, but that through our history-taking investigation, we come to the conclusion it's likely that transmission actually took place there. One thing I would say is that our resources are such that we do what we can, but we are not able to investigate to the degree that we would like to be able to identify when a number of clusters are in fact outbreaks. So there are situations where we see clusters. We advise about contacts being notified and being advised to be at home in isolation and seek testing. But we have a limited ability to be able to get to all of them to the same degree we would ideally want to do to actually declare them as outbreaks. We've been concentrating our resources on maintaining schools open and on the congregate settings where there's a higher degree of vulnerability and in settings where we've seen larger clusters.
Thank you as always.
You're welcome.
Erica Engel from Collingwood Today, do you have a question?
Dr. Gardner, how many deaths have there been now in fully vaccinated individuals?
I don't have that number offhand, I'm afraid. I will get that information for you and get back to you.
Okay, and then the other thing I wanted to ask about is the incidence rates over 8 weeks for unvaccinated and vaccinated hospitalized people. I can't quite reconcile them. So I have 188 cases per 100,000 vaccinated people over 8 weeks.
Mm-hmm.
But there are 450,000 vaccinated people in Simcoe Muskoka. So that would be like 800 hospitalizations over 8 weeks. I don't really understand that.
Mm-hmm.
You have
I haven't said, this is data that I got from our epidemiologists. And what I would be happy to do is go back and go over it with them and actually pull out not just the rate, but the actual numbers of such cases to make it clear, if that would help.
Yeah, that would be.
Okay.
And that's all my questions for now. Thanks.
Okay.
James Bowler from Cogeco, do you have a question this afternoon?
Yes, thank you very much. Dr. Gardner, starting out with outdoor events, and we've got a few parades coming up. Specifically, Bracebridge next week has a Santa Claus parade. And my thought and concern of this is that with the amount of underage infections going up, even with the vaccines going into kids' arms, one shot to begin with, still doesn't have enough time to reach that parade next week, which will be primarily attended by children. Is it appropriate to allow these types of events moving forward with this rate going up in Muskoka? We're almost at 50 now for active cases here. And it looks like there's no end in sight of the numbers going up.
I think that's a good question. It is an outdoor event that would greatly reduce the risk. The requirement for masks is part of it, actually. People needing to physically distance is part of it. I think you ask a fair question. Certainly, given the prolonged nature of the pandemic, we are certainly looking for things that we could allow in people's lives that would be a reasonably low risk and ways to mitigate risks so that they could have that enjoyment at this time of year in their lives. So an outdoor parade with mask use and advice for physical distancing was meant to achieve that. You're right that the timing of vaccination for children will not help us immediately with the surge of cases that we have. Really, its benefit would be perhaps 5 or 6 weeks from now, as we've achieved the first round of vaccination for children, we will probably have a strong response, even to a first dose with children, that will be greatly helpful, but it won't help us in the immediate month.
So just quickly, again, to follow up on that quickly, and I do have another question after that. Is there a potential that we could see these events canceled? I mean, there's going to be hundreds of people there, masked or not. That seems like a lot of people to be together in a time when we're looking at numbers going up.
Yeah, I'm not aware of any of my fellow health units colleagues where they've had a surge of cases where they have prohibited that particular outdoor activity. Their main concerns, and mine, have been more of indoor exposures. And in the case of Algoma and Sudbury, the main intervention that they pursued was putting back in place the capacity limits in a range of businesses and public service settings indoors that had been lifted through the month of October. So our main focus at this point in time has been indoor exposures.
All right, just as a follow-up, we've had a few reports of falsifying COVID-19 papers, vaccination papers in Muskoka. Concerningly, some of these reports are teachers and even a principal at one of the schools in Muskoka. And my curiosity is, what is the health unit doing to deal with this? And it's a bit of a two-pronged question too, actually. Is it actually illegal to falsify this paperwork with consequences? Is there a consequence to doing that? How does the health unit try to investigate that and actually lay these consequences for people that do that?
I actually carried out a survey of my colleagues across the province about that very question, and also my own staff internally, to hear. First off, it's very challenging to catch as an enforcer and act of falsification of that nature or non-compliance by a business for enforcement. You really have to catch people in the act to be able to do that, and that's very, very hard to do. We, might have a verbal report, like you say, that's very general in nature, but we haven't, having asked my staff this yesterday, haven't had definitive reports that we're able to act on that allow us to catch people in the act, so to speak. Very, very hard to do. It's not clear under the Reopening Ontario Act what the consequences would be for an individual who is using a falsified document, although in my mind that would be a form of fraud. But the consequences certainly are there with regards to businesses if they're non-compliant with enforcement.
Okay, so just to be clear, you're saying if an individual creates a fake COVID-19 document or purchases one, I'm not sure how they're doing it, but if they have that type of document at this point, there doesn't seem to be any consequences in place for that specific person.
It's not clear to us in looking at the Act and in inquiring with the province exactly what the sanctions would be for such an act. I think if we encountered it and were able to catch somebody in the act, so to speak, which is very hard to do, we would turn to police for guidance as to response.
Okay, thank you very much.
You're welcome.
Mark Claremont from Muskoka today. Do you have a question?
Yes, so just on muting. Could you clarify also on numbers, Dr. Gardner? You spoke of Muskoka, and I think you said at first 81 per 100, and then I thought I heard you say 87 per 100. Had that
81 cases per 100,000 population per week is the incidence COVID-19 over the past week.
Yeah, and I think Simcoe was 31 or something like that.
Simcoe was 67.
Oh, 67. I think I did write that down. Sorry. Yeah.
And overall for Simcoe Muskoka, 69.
So 69 or 81?
69.
So what's the 81?
Muskoka.
Oh, 69 is the combined. Yeah. Okay.
Yeah.
Does that mean you're going to have more clinics or in Muskoka coming up in the next few weeks, or?
Are you talking with regards to vaccination?
Yeah.
Yeah, we're certainly committed to providing the same degree of service in Muskoka as we are in Simcoe, and that was the case even through the majority of the pandemic when Muskoka was much lower in its incidence than Simcoe, and we're committed to continuing that level of equity of service.
Oh, so the equity, even though there's a rise in cases relative to Simcoe, right?
For the moment, it is elevated, and for the great majority of time at which it was much lower than Simcoe, we still provided equity of service.
Yeah. Thanks very much. Yeah.
You're welcome.
Mo Fahim from Muskoka Now, do you have a question today? Okay. Can we go over to the phone line? Are there any questions from the phone this afternoon? Okay. Was there anyone who didn't have the opportunity to ask their question? Okay. Well, thank you so much, Dr. Gardner, for your update today, and thank you to those who were able to participate this afternoon. Our next media briefing will be Wednesday, December 1st. Thank you.
Goodbye, everybody.
Recording stopped.
Anymore, so it didn't take long for everyone to band together online. I didn't even know Jake or Jordan or any of the musicians previously before the pandemic, but it was actually my professor from Georgian who messaged me. She was like, "Kat, you should play on the Barrie's live music show." And then I started to play just covers, and Jake and Jordan were like, "Hey, do you want to help us on the show, like help us coordinate?" So then from there, it was just about 5 people working together on Facebook. And since I used to work at the Chamber, I had a lot of the connections with the charities. So then that's where we sort of connected that way. So then every week we found a new charity, and then it just blew up because people needed connection, and everybody gets connected so well through music, so it just naturally happened.
Yeah. So you found there was definitely a lot of talent in this area that you could work with and draw from?
Yeah, like I thought I knew a lot of people just because I am in the scene a lot, but I was mistaken.
Yeah.
There's a lot of talent.
Writing, you do write obviously a lot of your own music, and some of it I've heard online, which is wonderful. During this time that we've just been kind of going through, how did you find writing? Did it inspire you, or did you find sometimes dealing with everything a little bit too difficult to kind of get into the flow of writing, or did it just come naturally using the pandemic as a source?
I actually haven't written a song this whole pandemic.
Okay.
I found that it was interesting. I wasn't playing live in public, but I was playing live online so often that it gave me more time to practice.